Now I'm going to introduce Denise Sikora. Medical insurance has become so complex in recent years, like we've been talking about a lot today, that many people have no idea how to make their insurance work for them to minimize the amount of money they pay out of pocket. People with chronic illness are more fearful about unpaid medical bills than they are about the treatment itself. These medical bills can pile up quickly, and unless you address them immediately, your credit can be ruined. Bill collectors are calling you, causing a lot of stress, things you just don't need when you're dealing with an illness. All of this can be avoided by taking a few simple steps to manage those bills before they become a problem. Denise Sikora, president of DL Health Claims Solutions, is a medical bill advocate, working on behalf of the individual to resolve unpaid medical bills quickly. She is here to talk today about the ways you can manage your bills and relieve stress. Get it out of your hands and into hers. Thank you, Denise. Here she is.
Thank you. I have some handouts up here on the table. It's just my PowerPoint slides if you'd like to help yourself. So I want to give you a little bit of information about my background, first of all. I was a medical bill manager and then an office manager for doctors in Central Jersey for many years. Mostly I worked in orthopedics and pain management, and patients would come into the billing office and tell us how hard things were for them because they had so many medical bills and they didn't know what to pay first. So I saw a need for someone to help the individual person, to educate them on their medical benefits, and to teach them how to navigate the system and advocate on their behalf. 6 years ago, I opened my own company to advocate for you, the individual, on your medical bill issues. So there's some really simple things that you can do to help yourself. And the number one thing is to open your mail. Many people come to me with bags and bags of envelopes, unopened envelopes, and a lot of them contain checks that they never even knew they received from their insurance company. So if you open your mail, you'll get all of that. You'll just deal with all of your paperwork. Get yourself organized. Do not let all of your papers pile up all over the place. Most people like to use their dining room table because it's a nice big surface, and then pretty soon the dining room table is covered and they're eating in the living room on trays. So you want to get yourself organized so you're not looking at these bills all the time. Hide them away somewhere in a file cabinet. You want to get a notebook, a stitched notebook. I get really detailed about these silly issues because they really make a difference in how you manage things. A spiral-bound notebook, those pages will fall out. You're in there constantly. They're going to be ripping out. You get a stitched notebook, you've got a permanent record that will be there forever. You should be addressing your problems quickly. Don't let them pile up. Months and months go by, 2 years go by, and you're still dealing with the same things. Deal with them quickly before they become a problem. And again, don't allow piles of mail to pile up all over your dining room table, your kitchen, etc., because it's a very stressful situation. And all that unopened mail is the unknown. Once you open it, you can deal with it. So the number one thing that you should do today is to go on your insurance company's website, create a username and a password so that you now have access to all of your benefits, your claims information, referrals, anything you want to know about your insurance is right there on their website. When we work on behalf of our individual clients, we get their username and password from them. So if they don't give us any insurance paperwork, we can still get it right there on the site. And you too should have that access. It will simplify your life dramatically. I do not, however, recommend that you click the little button that says, I don't want to get any paperwork anymore from you, I just want to get it all electronically. Because those explanations of benefits that you get from the insurance company, they're only going to be up on that site for maybe a year, 2 years. After that, they're gone. So it's much better if you get it in the mail and then you can keep it. for yourself. But that's an extra resource for you to be on their website so you can see what's going on. So I give a lot of these talks all over the state of New Jersey. And one thing that a lot of people wanted me to talk about was how to organize yourself. So I added this component into my talk, which is about how to organize all those massive amounts of paper that you're going to get from the insurance. So most of my clients come to me with loads and loads of files sorted by doctor. And every doctor's folder has 1 million bills, because every month you get another bill. So they just keep adding to that collection. We do not recommend that you organize like that, because if you're seeing 30 doctors, that's like a lot of files. That's overwhelming in and of itself. So we recommend that you have files labeled in this fashion. And this is exactly how we organize our clients' paperwork. And I want to add that I would say 60% of my clients are people that are dealing with some sort of cancer. So they have tons and tons of paperwork, boxes and boxes that they're delivering to my office. And this is exactly how we organize their files for them. So we have a folder or a section. We use a binder system with bills. We put all the bills in one section. This is just to organize your papers. You're not even doing anything with them yet. You're just organizing them. So you have a section for all your bills. Then you have a section for all the EOBs, those explanations of benefits from the insurance company. You just put them all in that one spot. Then you have your in progress or your pending folder section. That's where things that you are working on, things that are not being paid by the insurance, things that you're arguing with your doctor about, that's where all of that kind of stuff goes. Then you have another folder for claims that you have to submit yourself. How many of you see doctors for some services that the doctor doesn't want to submit to your insurance for you? And they hand you a statement and say, everything that you need to submit to your insurance is right here. How many of you have that situation? Anybody? You are so lucky, because a lot of people do. Speech therapy, occupational therapy, physical therapy, a lot of those kinds of services don't want to bill the insurance anymore, because the insurance companies really hassle them. They don't want to pay them. So a lot of times they want their money up front from you, and then they let you submit to your insurance. So if you ever have that situation, take all those statements and put them into a separate folder as a holding place for you, so you don't lose them. And then the last spot is the final. You want your final section that's all resolved and all fixed and done. You want that to be really big, and you want your in progress to be empty. Okay? Any questions so far? Okay. So I want to give you a little insight on what's going on in your provider's offices. Okay? Now, when I worked in the medical offices, I started out years ago as a medical receptionist. I was the one that was answering the phone, scheduling your appointment. And so the front desk area is the information gathering area of the office. And it's really hectic and crazy there. There's lots of paper flying around, and information is being taken from you, and sometimes it doesn't get into the computer. So if your insurance changes in the middle of the year, and you go to your doctor and you say, oh, I got new insurance, and they take your card and they copy it, they may not get that information in the computer. That could be one of the reasons why things don't get paid. The next area of an office that is really busy and crazy is the medical billing area. And those areas are very intense. That was where I worked for many years, in the billing area. And it's very intense in there. Patients are calling, everybody's complaining, they don't want to pay their bills. Why didn't the insurance pay? You're on the phone all the time, and it too is a very stressful place. So when you call your doctor and you get put on hold and then they never pick you up, it's just because it's just constant phone calls all the time. And one thing that I found as an advocate, which I lived in my little protected world in a billing office, I never realized how many doctors use billing services. So you're not even calling the doctor's office many times, you're calling a billing company that's sometimes in another state from where your doctor is. So another problem that we found was that your insurance could be making a payment to your hospital or doctor, and the payments are not getting posted to your accounts quickly. I've seen hospitals take up to a month to update your account after they got insurances paid. So you could be getting bills for things that were already paid. So I hope that you're not whipping out your checkbook and ready to start paying on these bills as soon as you get your first bill, because you want to give all of your insurances time to pay these bills. The other thing is that doctors' offices send bills monthly, every single month. Even if you were there yesterday and today's their billing cycle, you're going to get a bill from them. So I've seen a lot of people panic and say, oh, well, I guess I have to pay this $600 bill. Well, you were just there 3 days ago. Your insurance couldn't have possibly paid that bill yet. So what I'm saying here is yes, you want to address your problems quickly, but no, you don't want to write a check too soon. You want to let your insurance have time to pay the claim. So now I want to talk to you about what you should do if your bill looks wrong. So you get a bill from your doctor or your hospital or wherever, and there's certain things that you should do. First thing you want to look at is, does this bill have any payments on it at all? Are there any adjustments? Or is it just the amount of money that the doctor charged you? Because if there's no adjustments, payments, nothing, it's just a dollar amount, then nobody paid that bill. The insurance didn't pay it, it's still pending. So you do not want to write your check yet, okay? That's a holding bill. That's something that you would put in your bill folder and wait another month. Give it a little time. So say you've gotten several bills already from the same provider, and now you're thinking, well, all right, now I have to do something with this. So you're going to have to make some calls on that. So the first thing that you want to do is get all those explanations of benefits, or EOBs, that match that bill. Pull them all out of your folder, match them up to the bill. This is exactly the process that we use in our office. And we look at the EOB, and we look at the charges, and we look at what the deductible is, and what the coinsurance is, and what the notes say on the thing, and we figure out if it was paid correctly. So say that looks like there's something wrong here. Oh, something about this bill just doesn't look right. So you decide that you're going to call up your doctor's office. So you want to call that phone number that is on the bill to discuss the issue with the billing department. You don't want to call the front desk and talk to the receptionist. They know nothing about that. You want to talk to somebody in billing. So you get your little medical notebook out and your pen handy, and you get the name of the person that you talk to. Really critically important. You note this down in your notebook, the date that you called, and the details of the conversation that you had with that person. It's really important for tracking your conversations and your work that you've done on that bill to have all of that information. When you call your insurance, there's certain things that you need to get there also. So when you call the insurance company, you also get the full name of the person that you speak to. Now, I happen to know that when you call Horizon, the person will tell you their first and last name right in the beginning of the call, really fast. If you don't listen closely and get it down, they will not give you their last name again, no matter how hard you try to get it. They will say, well, you know, the first letter of my last name is this. So get that name down right away. And before you hang up from that person, ask them for a call reference number. You need to note that down in your notebook with the information from that call. Get all the details of the call in your notebook, and then call your provider back, your billing office of your doctor, and tell them, well, I just talked to my insurance company. I talked to Mary Smith, my insurance company, with this call reference number, and they said they're going to reprocess this claim. So what does that do for you? Well, number one, you have this bill that you're getting repeatedly, and more providers are sending 2 or 3 or 4 bills to you, and then they send you to collection. Okay? You're gone. Because they sell large lumps of bills to these collection agencies. And so anything that's 90 days past due is gone. But if your particular bill or your particular account has all these notes on it that you called, and you called on this day, and here's the reference number, and it's being reprocessed, they're not going to do anything with you, because they know, they see that you are making an effort to get this thing paid and to get it resolved. So when we work on behalf of our clients, this is exactly what we do. You, as the person with the insurance, it is your ultimate responsibility to get your bills paid, not your doctor's. Your doctor's office will tell you that. They will also tell you that they can't explain your benefits to you. I was just at a conference this morning for billers, medical billers. And this is exactly the topic that they were talking about, that it is not their responsibility to explain your benefits to you, it is your responsibility to know them. So the bottom line is that you need to know your benefits, and you need to keep in touch with your doctor's office about things that you're doing on your behalf. So how many of you have ever been told that you should write an appeal? Well, this bill's not paid, and we can't, you just need to write an appeal. How many of you have had that situation? Do you know what an appeal is? Does the average person know what that is? No, they do not. You get educated very quickly on what an appeal is, don't you think? So there's such a thing as provider appeals and member appeals. Now, provider appeals get handled through the provider services area of the insurance. And member appeals go through member services, completely different areas, and handled completely differently. Now, when I worked on the provider side, it was a real drudgery, because we wrote a lot of appeals and we never seemed to get another penny. But interestingly enough, on the patient side, it's a completely different story. So I write a lot of appeals for my clients because their doctors either have given up or maybe just never wrote the appeal in the first place. And I would say 75% of the time we get something more. We get our problem resolved from that appeal. I have to tell you, on the provider side, we were getting paid 10% of the time. It was very demoralizing. But on the patient side, it's a completely different ballgame. The insurance companies also have time limits for you to write an appeal. And you have to abide by those time limits. United Healthcare is very strict. They will not budge if you don't appeal within their 180 days that they give you. I have tried every trick in the book to get them to stretch that limit out, and they will not budge. So if you have United Healthcare and you need to write an appeal, you need to do it within the 6 months that they give you. So effective appeals have certain components. Now, I tell you this because I had somebody that asked me to write an appeal for him a couple of years ago. He had written his appeal first. He wrote a 15-page handwritten letter to his insurance company, and he included tons of medical records and notes in there, but with no reference to this information in his letter. So the first thing that you want to do is you want to verify the member appeals address with your insurance. You want to make sure after you go through all this trouble, you're sending it to the right spot. You would think that if it's not in the right spot, they would forward it. No, they do not forward it. It goes into the black hole of the insurance company. So you want to make sure you're sending it to the right spot. Now, how many of you remember learning how to write persuasive letters in school? Well, now you're going to dust off that skill and you're going to use it again. An appeal is simply a persuasive letter that you are writing to your insurance company, convincing them that you are right. That's all it is. So you want to be persuasive, you want to explain your case and why they should be paying your claim, or why they should be approving the service that you want to have done, or why they should be paying for the medication that you think you need or that your doctor says you need. You write a persuasive letter no more than one and a half pages long, no more than that. I never go beyond that. Never, ever, ever do I send something that's 2 typewritten pages. It's always 1.5 or 1. These are silly details. They're stupid details. Like, why would it matter? It does. It just does. So you want to be short, succinct. You don't want to ramble. You want to have your thoughts clear, everything chronological. It's very important to have that. That's what a successful appeal has. It has to be in writing. Many, many times they will say to you on the phone, the insurance customer service rep will say to you, you could do a verbal. It's not the same thing. The most important thing on an appeal is supporting documentation. The additional information that you send in to support your case. If you do a verbal appeal, you don't have the opportunity to send that in. So you also want to include the supporting information. Now, I have done appeals for medication approvals. Now, you know the insurance has the formularies, and they have the list of drugs that they're going to pay for. And they have Tier 1, Tier 2, Tier 3. And sometimes they have none of the medications that you want to take are on that, but you need to get approval for this. So I have done many appeals for medications, and I have gone on the computer and researched why this medication is being used, why it should be paid for. I've written my little persuasive letter. I've gotten the proof from the pharmacy of all the other drugs that were used that didn't work. I've gotten the medical notes from the doctor that say they don't work. And then we send it into the insurance company. And then lo and behold, they approve it. So it's all in the backup information that you send in. You have to prove your case. It's not enough to just say, well, you know, you should pay this bill. It's not enough. You have to have the backup. So once you get your whole case put together, all your supporting information, go on the internet. I do a lot of research on the internet. I did an appeal for someone that their insurance denied services saying it was experimental. And I went on the National Comprehensive Cancer Network. I called them. I called the American Cancer Society. I went to the National Cancer Center, everywhere that I could go. And each place that I went gave me more places to go. And I just kept calling, and getting all this information put together. What we were trying to do was to get another peer review on these records. The insurance company is saying it was experimental, and some doctor in some crazy place said, yeah, it is experimental. And we were trying to get the insurance to say, okay, you know what, we'll have a doctor that's in a top-notch cancer center review this and say it's experimental. That's what our goal was. We did get that. We got the second thing done based on our supporting information. So once you get all your stuff together, you make a complete copy of everything. Every piece of paper that you're sending to the insurance, you keep a copy of. And you mail it, certified return receipt, to the appeals address. You want to do that because when you're going to call them in a month and find out what's going on, they're going to say to you, we have no record of your appeal. And you're going to say, well, I have a record right here, the certified return receipt card that was date stamped on this day that it was received. They're going to put you on hold for 20 more minutes. They're going to come back and say, oh, yes, we have it right here. So you need to have your proof. And then the most important thing is follow-up. Don't assume that because you sent them a letter, they're going to respond to you. I usually give 30 days, and then I start calling. And the older it gets, the more often I call. And that's the rule of thumb that we have for appeals. So I want to talk to you now a little bit about how to prioritize all of your paperwork. So say you've let things go, you've got some things in collection, then all of a sudden you get this letter and somebody's suing you. And some doctors and providers will send you to collection, and some will sue you. They'll take you to court. They just think it works better. So when you get that kind of a letter, that's a high priority item. You need to deal with that quickly because you only have a limited amount of time to respond to the court. So you want to deal with anything that's a lawsuit first. The next thing you want to deal with is anything that's in collection. Because if it goes for a long time in collection and you've made no effort to contact the collection agency, it will ruin your credit. We talk to collection agencies all the time. We work with them as a team. They do not deal, a lot of times they don't deal with the insurance, so we will deal with the insurance and then tell them what we did. And it saves people from having their credit ruined. Because just because it goes to collection does not mean it immediately ruins your credit. It sits in there for a little while before they take that step. The next thing that you want to do is deal with large bills that do not appear to have been paid by your insurance. Say you get a bill for $30,000 and there's nothing on that bill that says that your insurance paid it. And you go on the insurance company's website and you can't even find that date of service in there. You need to call your provider immediately and ask them to resubmit the claim. Do not just wait and wait and wait, because providers have a limited amount of time that they can send their claims in. Once it gets past that time, it's automatically denied. So deal with those bills quickly. Then the next thing after that is any other bills that have not been paid yet by your insurance. You get a bill, it's little, a couple $100, that's big enough, but it's not thousands. And you go on the website, that's always your checkpoint. You don't want to dig through all your paper, so you go on the website, you can't find the bill, you call them up and you ask them to resubmit. In these days, everything is done electronically. But here's the deal. The providers will send the claims electronically. Then they get a report back from the insurance company saying if the claim was accepted or rejected. If they don't fix the rejections, the insurance never gets the real claim. It just gets dumped. So they may have sent it, but it never actually got processed. So if you don't see it in the system, call them up and ask them to find it and resubmit it. You want to pay your small balances quickly. I can't tell you how many people go to collection for $20. How many people's credit gets ruined for $20? It's not worth it. If you can't afford to pay for that $20 bill because you have 15 other $20 bills going on, send them something. Send them $5, anything. Just send them small dollar amounts every month, and they will leave you alone, usually, especially for these little $20 bills. They're getting money, they'll be happy. And how can you minimize your expenses and your out-of-pocket expenses? Well, the number one thing is to know your benefits. Know what your deductible is. Know what your coinsurance is. Know what the maximum amount is that you're going to have to pay out of pocket before they start paying 100% of your bills. If you need referrals on your plan, you need to get them. Years ago, doctors' offices would not let you past their waiting room if you didn't have a referral in hand. It's not so rigid anymore. That front desk staff is busy and they're just not paying attention. They'll let you see the doctor and you didn't have a referral, they are never going to get paid and they're going to bill you for that balance. So if you need referrals, it's your responsibility to pay attention and get them. Stay in network whenever possible. That's the one way to minimize your out-of-pocket. It's not always possible. If you can't stay in network, it's okay to make a conscious decision that I'm not going to stay in network. I recognize I'm going to pay more money. I feel so badly for the people that don't realize that they're going out of network, and then all of a sudden they have all these bills, and now they're stuck. If your insurance requires pre-certification, you would think that the providers would know this and that they would get it. But many, many times they don't. There's a lot of offices, especially the small offices, where they just don't have the staff to get it. They don't know. Their insurance people really are not up to speed. So if you need an MRI and you know your plan needs an pre-certification, make sure somebody gets it. You can call and get it, even if your provider doesn't. And the most important thing is to give all of your insurance information to every single provider every time, whether they ask you for it or not. If your insurance changes and you haven't been to this doctor and you're not sure if they have the information, you just go, oh, can you just verify my insurance was Blue Cross, now it's Aetna. Can you just check and make sure you got the right insurance information? I had someone who, I work a lot with this organization called the Wellness Community. I do a lot of workshops for them in Bedminster and in Eatontown. Every month I'm there, actually. And one lady came in and she had gone for a test at one of the hospitals, and she never gave them her insurance information. So they put her down as a self-pay, and they charged her $400, which she paid them. Then they gave her a statement. She came home and she sent it to her insurance. Her insurance paid them another $400. It has been 6 months, and we are still fighting. She is actually still fighting to get back that $400. So make sure you give them the insurance information, because her answer to them was, well, you never asked me for my insurance. And they said, well, it's your responsibility to give it to us. So it goes just around and around in a circle, everybody pointing the finger at everybody else. Bottom line is she's out her $400 until she can get it back. So just make sure that you give them your insurance. If you have more than one insurance, a lot of people have 2 insurances. Make sure they know which insurance is first, which insurance is second, and that they have all that information, because you want them to submit to your second. So the last thing is that you can get help. You can register family members or friends as personal representatives with the insurance company and with your providers. So in this day and age, with all the HIPAA laws and everything else, the insurance company will not talk to you if you're not on the plan. So say you have one insurance, your husband has another, and your husband wants to call for you, they're not going to talk to him. He has to be registered as a personal representative with the plan. You go on their website and you download the form. You fill it out and you send it in. That's exactly what we do. And we are personal representatives for every one of our clients with their insurance. The other thing you can do is you can hire a medical bill advocate to act as your liaison to facilitate claims payment and work with your providers. And what we do as medical bill advocates, and there are many companies out there that do this, they just step in, they work on your behalf with the doctors, with the insurance, with the hospitals, whatever, and get those bills resolved. And it takes the stress and the burden off of you so that you can get healthy and take care of your family, and they get to deal with all your paperwork. And then your dining room table is empty and our file cabinets are full. So this is where you can find us. We're located right in Woodbridge, and we do not meet 75% of our clients. They call us up on the phone, they mail us their paperwork, and then we talk to them over the phone and by letter and email. 75% of people just put their stuff in a box and mail it to us. The other 25%, we go to them or they come to us. There's other places where you can locate advocates. Claims.org is a national organization of people that do the type of work that I do. There's people with all different backgrounds there. There's lawyers, there's people that worked on the insurance side, paying the claims, they have different knowledge, and in almost every state. And the other thing is that most advocates can work in other states. I work in every state. I've had clients in California, in Nebraska, in New York, so it doesn't matter, just what you feel comfortable with. And then the other site, Claims Assistance Professionals, that's a website, and they list advocates by region. So you can go there and find people there. So does anyone have any questions? Yes?
Give you the mic. keeping up on my bills and making sure they were being paid. And I came across a procedure that the hospital billed my insurance company twice for, and it was $4,000 each time. So when I noticed it had the exact diagnostic code, and it was the same date of service. So I called the insurance company and I said, you know, don't pay this. I said, because it's the same claim twice. You know what they told me? Too much work. We're going to pay it. We just pay it. That's why why do they give us problems if, you know, I said, if I can go to my boss and say, I can save this company $4,000 on a claim, you would think they'd say, all right, good job.
You would think so. You would think so. But you know what? When we get explanations of benefits from the insurance company, but no bill ever comes from the provider, we don't get upset. Okay? We cannot fight every battle. So we only deal with it when it has a bill from the provider. If you get a bill from the provider, then you deal with it. If you just get a statement from the insurance and you never get a bill from the doctor, then, you know, what are you going to do? You can't track everything. So if that doctor had billed you for that second procedure, then I could see you making a big stink about it. Okay? Because why would you want to pay twice for the procedure? But you can certainly call the doctor or the hospital up and talk to the billing department and say, you know what, you billed this twice. You need to take it off. You need to send that money back to the insurance.
That was my way of getting back to the insurance company.
I'm sorry?
That was my way of getting back at insurance companies. You don't pay attention, you pay your bill twice, I'm not going to fight for you.
You know, what's going to happen, and here's what will happen with those duplicates. All insurance companies audit their records. They audit their claims every year. And what will happen is they'll find that duplicate payment. Then they'll send a letter to the provider and they'll ask for the money back. And even better than that, here's a ploy that Horizon started doing a few years ago, was they would send a letter to the provider. The provider didn't send the money back. They would take the money back on future payments. So say you have Blue Cross and everybody in this room has Blue Cross, and they double paid on yours. The doctor didn't send it back. They take the money back on every single other person's bills. Okay, they wouldn't pay on all the rest of your claims until that dollar amount was matched. So it's up to the doctor then to move that money around in his system the way it's supposed to be moved around. But let me tell you, it creates havoc in the office. But they do get their money back. So maybe they didn't catch it now,
Yeah, this
but
was
the
17 years ago,
the
so I don't
auditors
know.
down the road will catch it. How many years ago was it?
Over 17 years ago.
Oh my goodness. Back in those days, that stuff didn't go on, okay? The insurance company paid twice, and if nobody caught it, then nobody said a word. And actually what happened was the doctors were getting these overpayment letters when really there wasn't overpayments, and they would refuse to send the money back. And they'd say, no, I'm not sending the money back, it's a lie. And so what happened was the insurance companies had to come up with a way to get their money back, so they started taking it back. But there are laws now that say that they can't take it back further than 18 months. So if they find out 3 years later after the date of service, they can't take it back. It's too late. They have 18 months to find it and take it back. Any other questions?
They had 17 years, so.
Yeah, that's like too far back. Nobody cares. Any other questions?
I have one.
Sure.
In regards to what you were saying, I'm so glad you said that they find it and audit and the money gets returned. Because I was worried about that going towards Ryan's cap. You know, his insurance, he has a $2 million cap. I know that's a lot of money, but I was concerned. I'm like, gosh, if they're overpaying, is that going to hurt his limit?
Yes, of course it would hurt his limit.
That's why I was afraid, but I'm glad you said so. It's something I shouldn't stress about. Let it go, hope they catch it. Because I have called them on it as well and try to fight it, but like you said, they just don't seem to care.
They will find it.
Okay.
They do.
Okay, that's reassuring.
They do.
Test that you've had done, and it might be like one of those tests where it's like it can only be done like yearly. Okay?
I feel like Phil Donahue.
And I forget where I was at now. They've double paid on it, and then they're not going to cover you for that year because you've had it done already. You know what I mean? You had a test done.
Mammogram or something.
Okay, like a mammogram, all right? They're only allowed done yearly. your insurance company paid for it, or they said they paid for it, and they never did, how are you going to get that test done?
Okay, so they said they paid for it. You have no explanations of benefits that
Your
says.
doctor's office, excuse me, your doctor's office sent it in wrong, saying that you had this service done on this date, and it's a test that you never even had,
Okay,
all right? And then suppose you need that test, but it's one of those tests that are, how do you fight that with the insurance company?
okay.
That's something I'm going through right now.
So your doctor sent the claim in wrong,
Exactly.
and you believe that you never had that test. Say, for instance, like a bone density test.
Yes, exactly.
Is
That's
that the
what it was.
test?
Yeah,
Okay.
exactly.
Okay, I see that a lot.
Okay.
So a lot of people do not, they come to me and they say, well, I never had this test done, so I don't know why I'm paying it, and this used up my radiology benefit, and now what am I going to do? So if you don't think that you had that test done, you can get your medical record. Request the record that says, here's the test, here's the report, here's the order, here's the script. There's a record of this in your chart. So request the records.
5 times I did it.
5 times you requested
And
the
they-
records?
Yes, well, no, they all agree with me that I'm right, that I had this done 2 years prior to what they're billing them this year.
Who agrees?
The insurance company, the location where it was done, the imaging place there. And they're still saying, oh yeah, you're right, but nobody's doing anything. And I go, well, what if I need this test done again, bone density?
Well, my rule of thumb is you make so many calls over the phone, okay? 2 or 3 calls. You can't get anywhere, and you've done it 5 times. After 2 times over the phone, it has to be in writing. You have to put stuff in writing. It's the
Okay.
only way that it gets fixed,
Okay.
is in writing. And if you continue to have problems with your insurance, problems with just all kinds of silly issues, you can always contact the Department of Banking and Insurance in New Jersey. It's a very powerful organization in New Jersey. If you have a New Jersey-based insurance, they're a wonderful, wonderful resource, and they're very powerful. Less so in other states. So if you have any issues like that where one place is saying you had the test, the other place is saying you didn't have the test, and it, you know.
They're all agreeing I had it 2 years ago.
But there's no record of it.
Oh, they have records and all. They're all agreeing with me, but nobody's doing anything.
Well, talk to me afterwards, because I'm not exactly clear that I understand your question, okay? And I'll try to tell you how to fix it,
Okay.
okay? Are there any other questions? Okay, thank you very much for your time.
Thank you, Denise.